So in a normal aging brain, there are things that happen. If you look at the brain of a person in their 80s or 90s, there's going to be some volume loss. Blood flow is not as robust. There's less connectivity between neurons. And so the connections are not as robust, but they can still happen. But the connectivity is less effective. And neurotransmitters decline, things like dopamine and noradrenaline. We just don't make enough as we age, and that actually impacts overall brain health. And that's all part of normal aging. So how does this experience? In normal aging, people will experience changes in memory. They may notice that their attention span is shortened, or they just have more difficulty paying attention. Their brain starts working a little slower. They're not as quick and sharp as they used to be. They can't multitask. They might have difficulty finding the right word. All of this sort of falls in the realm of normal aging. We wouldn't get super alarmed if somebody at a certain age came in and described some of these symptoms. Okay, so let's talk about neurodegeneration. This doesn't happen just in MS. It can happen in lots of different conditions, Alzheimer's, Parkinson's, etc. And what makes this different than normal brain aging is that it happens at a faster rate. And people might become aware of the symptoms more quickly, whereas with normal aging, it happens so slowly. Sometimes it kind of takes a while for it to catch up with you. And you may lose functions beyond what we would expect with normal aging. So you can have rapid changes in memory, and there isn't only one type of memory. There's different types of memory. And so a neurologist can dig into that deeper to figure out, well, what is actually the change in memory? What's actually happening? Difficulty communicating, whether it's with finding words or being able to organize speech. There may actually be behaviors that fall outside of social norms. So age is actually the #1 risk for neurodegenerative diseases. Like if you think about Alzheimer's, it typically happens to people that are much older. So age is the #1 risk factor. But if we were to personalize this to our group, MS is another risk factor. It is a neurodegenerative condition. And unfortunately, whether the neurodegeneration is due to Alzheimer's, Parkinson's, MS, there really are no drugs or supplements that can prevent or stop dementia and that, cognitive decline. We just don't have those. There are some medications that can actually slow down the progression of some dementias in the mild to moderate phase, but not when it's more advanced. But they just slow it down. They don't prevent it and they don't reverse it. So let's talk about MS and the neurodegeneration that happens. As we get older, we may shift from a pattern of having a lot of neuroinflammation to a more neurodegenerative pattern. And on MRI, there might be more atrophy that can be visualized, and disability starts to progress, right? So you might go from having lots of relapses to now kind of having a more steady decline. And something that is really interesting is right around menopause, when there's a steep drop in estrogen, you can actually have more disability. And so we sometimes use the EDSS as an objective way of quantifying disability, and we can see a progression of the EDSS score. Now, I don't want to leave out the men in our group. Testosterone also plays a role. Testosterone is an immune modulator. It actually fine-tunes the immune system. And so whenever I have a man who is a patient of mine who may come in with an autoimmune disease, an inflammatory disease, cardiovascular disease, they have a heart attack, especially at like a younger age, I always would check their testosterone system to make sure that the testosterone is not low. All right, so you may have heard of smoldering MS. And the person that I keep hearing it from is Dr. Giovannoni, who's also known as Professor G on social media. And he's really, and his colleagues have brought this issue to light. And this is a wonderful paper if you want to grab it and read it, because I think this is something we really need to start paying attention to. I myself, as someone who has relatively stable MS, I worry about this because you can have this process in the background happening even if you're not having a lot of relapses. And if you think about what smoldering is like when a fire burns out and there's no more flames, but there's smoke. This is sort of that. It's happening in the background. It's not really obvious until it's been happening for a long time. And they go on to state that this progressive accumulation of disability in MS can happen independent of relapse activity, right? So there's two things happening. You can have relapses, and then you can have this smoldering MS in the background that over time contributes to neurodegeneration and progression of disability. And we need to start thinking about what we can do beyond DMTs. Or, we need to start coming up with therapies that actually address this. We don't really have robust pharmaceuticals to address this problem. However, there are lifestyle habits that can set you up for success, and we will be talking about some of that.